Hey there, I'm back with episode 2 of 2 so far about my breast cancer experience. I keep calling it a journey. It sounds so woo-woo, and I'm not really woo-woo. Anyway, when last we spoke, I had and actually I misspoke in my last video, I had a regular routine screening mammogram on May 4th, and they wanted me to come back for a diagnostic mammogram, so I came back on the 8th. That's when I had oh, you've got calcifications, you should come in for a biopsy. So I then, and I'm checking my notes here to make sure I get my stuff right here. Right, so then I came in for the biopsy, and that was done at my little local, medical center where all these other appointments have been. And it hurt a bunch, like a whole lot. I've had, I guess, so I need to give 2 bits of background information. One is I had an abnormal mammogram, I think like 6 years ago, and had to go in for a biopsy, and for the same thing, same area, same breast, upper right part of the of the right breast, and they found microcalcifications, a little cluster, and they wanted to check them out. As expected, they were nothing. So they put in these little tiny clips. It's like a little, so the biopsy itself, I was sitting, this is in University of Pittsburgh Medical Center, and I was sitting in this interesting chair, and the doctor drills that sounds really awful, inserts a hollow needle, like a wide gauge, not like that, but like, and they take a tiny little sample, like a few millimeters across. They just stick it in where they have identified the calcifications as being, and they take a little core sample, and they send that, tissue off for analysis. And at the same time, they put in these tiny little wire clips, teeny tiny little wire clips, to mark where they took tissue from, so that those are identified as having been biopsied already. And each one of those little clips has a different shape, and that's noted on your record. So later, when another pathologist or whoever looks at your records, they can see, oh, the bow tie one was, biopsied on this date at this time and was found to be benign. So, and the second piece of background information is that in the midst of all this, I got laid off from my job, which I've had for 21 years. More than 21 years. So the initial screening mammogram was May 4th. On May 7th, I got a meeting request from my boss saying, scheduling an appointment for the next day at 2. That was a Friday. And I thought maybe it was rescheduling some other, like a standing appointment that we had the following week. And she said, no, that's not it. She didn't say much, but given sort of the climate, the workload, and the fact that this was just kind of an out of the blue appointment, I knew what was coming the next day, that I was going to be laid off. So miserable. I mean, I was so upset. I'm 60 years old. Or I'll be 60 in a couple weeks. I fully intended to retire from this job in another 9 years maybe. So I'd been there for 30 years. Just felt like a good, even number. So I was really devastated. So Friday morning comes, and that's when I'm scheduled for the diagnostic mammogram. And that's when he tells me, you've got to come back in for this biopsy. So I go in for my biopsy on Tuesday, the 12th, and they do the same kind of core sample thing, but this time, instead of sitting up in a chair, they have me lie down, face down, boobs down, on this table that's designed specifically for this purpose, for breast procedures. It has a, let me see if I can put the phone down here and do this with 2 hands. Okay, I'm going to try this again. I don't know what I did yesterday that I was able to use my hands, but anyway, whatever. I'm new to all this video content stuff. Okay, so there's this on the table, which is sort of like a doctor's exam table, where it's kind of covered in that vinyl-y, plasticky stuff, padded, but like only nominally. And there's this kind of rectangular opening in the table where you stick your boob down through it. And there's like, like in the mammogram, if you've had a mammogram, these things called paddles. They are not really paddles. They're big plastic mashers that, are meant to hold your breath still while they do the imaging. So there's a similar kind of setup there where they keep your breast clamped in place and the doctor does whatever he does from underneath. It's very weird. Anyway, all kinds of indignities too. Like, I won't even bother with that story. That's a good story for a side note sometime. But anyway, they do a local lidocaine injection anesthetic, which hurts. It's no fun, but certainly more fun than feeling the big needle go in. And all of this, like the previous biopsy, is what they call stereotactic. So they determine where to aim the needle for the picking out the sample by computerized XYZ coordinates of your breast. So they insert the needle, they collect the sample, and they extract it. Should be super quick and simple. However, I am a big baby about pain. I apparently don't take anesthesia very well because all this, they had to redo the lidocaine many times during this procedure. I think I was in there for like 45 minutes or an hour or something, like in the procedure rooms, notwithstanding the fact that I was in like a waiting area for hours before this, but whatever, it's fine. Everyone was super nice. I should say the nurses, the staff, everybody at this facility, this Central Vermont Medical Center in Berlin, Vermont, fantastic place. I love it there. Anyway, so Dr. Zedens, the surgeon, does the biopsy, and I was in a lot of pain, partly because of the stuff he was doing to my boobie, but also because the way that the exam table is built, it's kind of like this. Your boob goes through the hole here, and then your neck and your head are up on this thing, and you have to lay with your head sideways. You can't lie with it face down. I don't know why. What they need to do, and I told them I was going to write a letter to the people who make this table, but I forgot to get the name of the company. Maybe someday I will. To tell them they need to do like what massage tables have, where they have a cutout for your face and whatever. Anyway, so you have to lie with your head completely turned to the side, like to a painful degree, and then it's got to be upward. So you're like this the whole time, and you cannot move. If you move even a little bit, they miss, the spot, and they have to relocate it and everything. And they did actually have to take the needle out and reinsert it to fix, because I couldn't stay very still because I was in so much pain in my neck. Anyway, there's a very nice nurse named Kathy there whose sole job was to like hold my hand and strip my hair and comfort me and tell me what a great job I was doing. I did not do a great job, and she was awesome. It was great having her there. Everybody was great. After that, I had to go back to the post-anesthesia care unit, PACU, to wait for the anesthesia to wear off or whatever in case I needed to. So anyway, I go through all that, and I get the notification on the 15th, which is Friday, which is the last day at the job, I got laid off from the previous Friday, I get a call from Dr. Zedens, and it shows up in my chart first, but I get a call from Dr. Zedens saying that they found these microcalcifications, and what they found, I'm reading from some notes here, sorry. So I have two things happening. The first thing they found is this ductal carcinoma in situ or in situ, which DCIS, which is not uncommon, and it's considered a stage 0 cancer if you've got cancer cells there. It's carcinoma. Anyway, and it's not usually something that they do anything about if it's just in situ. But in my case, it had a solid pattern, meaning there was a solid tumor, with central necrosis, meaning that there are cells in the middle of this tumor that were dying because they weren't getting any blood flow. And so they think that the nucleus of this was a grade 2, but the area itself, the focus, was a grade 3. They won't know staging and grading until after the final pathology report, which we'll get after surgery, which I'll talk about in another video. But that brings us to the second thing is the foci were suspicious for microinvasive carcinoma, which means they're seeing evidence that some of the cells from the DICS are poking their way through out of the duct and into the rest of the breast. So that's not good. So they they ordered tests to see whether there were any hormone receptors. They do 3 of these tests. They do an HER2 assay, which I'll have to look up what that stands for. I don't remember, but that was negative, but indeterminate for me. They also later did a estrogen and progesterone receptor tests. I don't know what the progesterone test came back as, but the estrogen one came back negative. What that means is that estrogen in my body is not driving the growth of this tumor, which if it were, estrogen hormone therapy would be a treatment that could be used against the tumor. Since I don't have that, that's not an option. It also is consistent with this grade 3, which is an indicator of the aggressiveness. So stage is how far along the tumor is, and grade is how abnormal and fast growing the cells themselves are. So I'm early, very early, but the cells are super pissed off and going wherever they want. So that was the biopsy and the pathology. And so, sorry, I'm looking to see, I know there was another appointment I wanted to, pathology, blah, 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 blah. Yeah, I guess that's, so, I have a few other results on this pathology that I will look up because I don't remember what they all mean, but E-cadherin is positive in areas of DCIS. Don't know what E-cadherin is. It says E-cadherin 36B5 Leica. Leica is a camera brand, so maybe that's technology that they used. That's A1, whatever that means. And, it's the antibody is E-cadherin. The clone is 36B Leica, and the block is A1. We'll find out what that means, and I'll put it in the notes. For P63, there was a loss in the glands that were suspicious for microinvasive carcinoma, and the heavy chain myosin, the P63 was in block A2, and the heavy chain myosin was also in block 2, A2, and that's also a loss in the glands suspicious for microinvasive carcinoma. So, I then met with Dr. Zedens about next steps, and he was the surgeon who did the biopsy. He's a general surgeon at CBMC, and super guy, very nice. Although I was really mad at him when he was poking my boobs and hurting me, stabbing my boobs, as I told him. He said that the next thing he would recommend would be a lumpectomy to remove the tumor. I don't want a lumpectomy for a variety of reasons. One being that this aggressive form, this particular type of cancer cell that I have going on, is highly likely to come back. So I don't like my breasts anyway. I don't want them. I would love to be flat. I actually talked to a plastic surgeon a couple of years ago about getting a breast reduction because I'm so over having big boobs. So I told him I want to do a bilateral mastectomy, get both breasts removed, and have a flat closure. An aesthetic flat closure is what that's called. And I will wait and talk more about that choice in another video.